Hi, my name is Satkarn Shergill, and I have done a biomedical science degree at Nottingham, Trent, and have been requested to conduct a video for those who wish to pursue a course after biomedical science into medicine. Now, um, many people take many routes to go into medicine, but the traditional way is to do A levels and go into medicine. But not everybody can get into medicine that way. So the second option that most students take is by pursuing a BSc degree or a first degree in another subject and then going into medicine. Of course, that subject, depending on how related it is to medicine. It depends on the university, of course. Some universities take variety of courses, whichever course you've done in BSc, as a first degree. So people may take many routes, such as doing physiotherapy or biology itself, or even neuroscience and variety from A to Z. But this video is going to consist of why biomedical science and how biomedical science equips you to do medicine. Now, understanding that this degree, the biomedical science, is a BSc honors degree, so this degree will equip you to understand science itself and research behind healthcare related topics. But my advice has always been to students who wish to pursue medicine in the first place, is to get some sort of experience. Now, before we start rambling on about biomedical science, I want to get a couple of things clear. Is that I'm already in medicine after my biomedical science study, after graduating at Nottingham Trent University. So what we have to understand here is that many students who do want to do medicine, I will recommend them and advocate them to do medicine. To do medicine, you have to be able to get some sort of experience, because you have to write it in your personal statement anyway. So, what kind of experience are universities normally looking for? Well, it depends on the university itself, but as a experienced person who's been through the procedure, I would say, there's nothing like, oh, I have enough experience, there's always room for more. And the experience that I've taken is healthcare, so care work. That's one of the major experiences that I think that you will, if you take that experience, do work as a health care worker, you will see how interrelations that you have with the patients and people who need support and who are already on medication, and how to deal with this everyday life. So some people who do carry out these experiences and find these works or voluntary work as well, sometimes regard medicine not their thing. So I would recommend people to do that. Find out if you think that this is your path first. If you're really passionate, you will do it, and you will find it very interesting and very satisfying, because helping someone everyday daily life, or just doing daily things like brushing their teeth or changing their clothes or something like that, that will just put you like, yeah, you've got some sort of responsibility. That person is relying on you, and that trust relationship between that patient to care and the worker itself gives you sense of responsibility, a sense of confidence that yes, I can handle this. And trust, even once you become qualified as a doctor, trust between a patient and his doctor is very important as well. So I would always recommend that any experience that you can get, either family members or anyone you can ask and get this sort of experience, is very good, because there's no such thing as too much experience. And what I would also say is that, coming back to biomedical science, that of course I tried the normal route from A levels to apply for medicine. You can either apply for foundation year for medicine and then get into medicine straight away after that. But those require special requirements. But if you do not succeed in that, there's always hope. Okay, and the hope that is that you can do biomedical science and then go into medicine. Now, biomedical science itself is a course which teaches you healthcare related modules. So, from hematology to pathology, histopathology to biochemistry to clinical biochemistry to cellular biology and to living essential organisms, and all the systems that you have in biology and everything come into this area. So I would always look at the modules, see which modules appeal to you, but some of them you might not find appealing. Same with medicine itself, because I'm studying medicine right now, and some modules you may not find it. Some people find medical physics very interesting, and some people don't. Some universities do medical physics, some people don't. So, of course, biomedical science as a whole is a very thrilling and interesting subject because it's a collection of everything rather than just one narrow of things. It's consists of many variety of things and puts it into one. So you've got biochemistry, you've got microbiology. So all these things that you have, like pharmacology as well, you understand everything with basics and then you join them together. So when the final year comes, you understand that everybody knows that the final year you have to do a project. And in this degree that I've did in at Nottingham Trent University, um, it was related to celiac disease, the research project that I carried out, looking at TG2 receptors, and they are related to celiac disease, seeing if anything can block it or amplify the response. So my advice is that if you've done biomedical science degree, you'll get a lot of sufficient knowledge about disease itself, biology itself, and mainly what areas of prognostics and histopathologies and all those areas that you will need to use to study medicine. Of course, you won't use all your skills in the first or second or third year of medicine itself. You'll use it variety away, but it will also help you in life. Once you become a doctor, you will use those skills all the time. Of course, if you look at it as a overview, there's also two options you can take. This biomedical science degree can also be considered as a sandwich course, which is what I did. Which means you take a year out in industry placement. I did it with the NHS at a hospital, joint partnership with the local university. And what you do there is that you work as a placement student, and you carry out research of the people who are conducting the team that's conducting the research. You help them and you assist them, and then you get also it's paid or non-paid. You can it depends on which one you can get. Advertisers are all over the place, and Nottingham Trent University does help you with that. So you're not just chucked in the deep end and then expected to fly, to swim. So why? How does biomedical science exactly help you? Well, in biomedical science, what I've learned so far, and is that the degree itself concentrates a lot on disease itself. Now, you could do physiotherapy, you could do biology, you could do ecology, you could do biochemistry, but this biomedical science concentrates on disease. So all the biochemistry you know will be basics as well, with the basics and understanding biochemistry itself, but relating back to disease. And as a doctor, you're more interested in diseases, pathologies, and of mechanisms that you will understand. And once you understand a couple of mechanisms, and in biology itself, they're quite similar to each other, but some vary a lot. Some vary a lot. Don't get me wrong, but some are very similar. And once you've understood that, you will see how things relate with each other. So once you've done a module in hematology, you'll know what types of blood cells they are and how to count them, and what diseases you can get from blood. There's a lot of diseases in blood that you can identify. And in histopathology, it's all about cancer. So oncology is touched in that module, and that's in your final year. Um, in that module, you learn about cancer cells, what cancer is, and how you can identify cancer by markers, enzyme markers, or other types of protein markers that you can use, and how to look down a microscope and identify other microorganisms, such as microorganisms such as the ones that cause you infections, Staphylococcus aureus, for example. So these ranging from a variety of things that you can study from biomedical science. You also have to understand that this degree tells you about infectious diseases and how to control them as well. So you look at the wider population, how outbreaks of flu happens, and what we can do to prevent these outbreaks, and food poisonings as well. Food poisoning is a very easily outbreak if there's a source of food poisoning in one area. And if people do not wash their hands, or do not know how to wash their meat, or their vegetables properly, so it can cause severe diseases in the community. And the vaccinations, how vaccinations are important. You have immunology as well. So as all these subjects that you will study in biomedical science, it's a variety. I could go on forever, but immunology is also part of medicine. So all the modules that you conduct in biomed, you'll be conducting in medicine anyway, but you also have a background knowledge. Of course, some people might think, oh, it's a waste of time, but that equips you. It equips you so much that when you come into medicine, you find it more easier to handle. And because you've got that research brain lock of how to think as a research scientist, because biomedical science can go into research, and you're always thinking of questions. Okay, if A plus B does this, I wonder what C and D do, and how do they relate, and what kind of controls you will use. So of course, you can take a variety of questions of how it helps you. But I think as a doctor, if you want to be a doctor, biomedical science is a very fantastic route to take, and it equips you a lot. And coming to the research project that I've told you about, of course, take the one that is related to health, because you might take a protein that changes shapes, you know, but that won't help you in medicine, you know. So take everything that you take in life, take it towards that leads towards medicine, I would say. The modules I've already explained, and a placement year, which is what I did in the hospital, when I'm coming back to again, is that a couple of things that you need to understand is that in the hospital that I worked, some of the you'll meet doctors there. So that's one thing. So you get to see everything live in action from the doctors. Some will be GPs, some will be pediatrics, some will be clinical doctors, and you just talk to them and see how they feel in medicine, how they do stuff. You'll be helping them out, carrying out samples, you'll be pipetting some stuff. I did work with fumigatus and fungus, so that really helps. And you talk to many people and go to your local site. You see if there's any voluntary work, and it will equip you. It will always equip you. But biomedical science itself equips you also, and it explains through diseases. You do a lot of labs. You know, you handle biological materials, from urine to radioactive materials to blood. You'll be handling a lot of biological material. But if you find it disturbing, then it's going to be a difficult path to take. But my suggestion is that if you are really passionate, no matter which path you take, you will succeed. I'm sure of it. And of course, there's other routes as well. But this video was made for biomedical science. And yes, biomedical science. It's just a different area, and it just gives you a totally different scope of how diseases are seen as. So I would always recommend you guys to, if you are going to take a second, the route I've taken is to go with biomedical science, as I've done the biomedical science degree, but it's a fantastic route to take. Thanks for watching, and if there's any more questions you would like to ask, there's always, I think there's room at the bottom to ask. But all the best, and I'm sure if you are very passionate to do this, you will succeed.